this low back pain, slip disc, and sciatica, or are all of this is correlated. I mean, all are related. So slip disc is, see, between the bodies. I mean, there are multiple vertebrae. Between the two vertebrae in the spine, that is the disc. So in between the two bones, there is a cushion which is called a disc. Now this disc has two components. Inside there is a nucleus pulposus, which is a jelly-like structure, and outside the disc, I mean the outer part of the disc, is like a fibrous tissue. When the nucleus pulposus or the jelly-like structure, it comes out of the entire disc and causes compression on the spinal cord or the nerve root which is behind it, that will then you call it as a slip disc. So even if patients, like if you see normal patients, if you do an MRI, suppose if there are maybe, if you take any patient or maybe 30 or 50 or 100 patients and you do their MRI, so and they are asymptomatic in the sense they don't have any low back pain or slip disc. But if you do their MRI, 30% of the patients will have a slip disc. So if that nucleus pulposus is herniating or coming out, that is called a slip disc. But most of us will be having a slip disc, which we are not aware, even though we are asymptomatic. Slip disc, it depends. I mean, if you are not taking precautions, of your precautions, I mean, cautions that can cause an injury to your back, is going to cause a slip disc. And number one would be, again, lifting heavy weight, and it will most commonly occur with smokers and obese individuals. Patients, as soon as there is a herniation of this nucleus pulposus, which is the jelly-like structure within the disc, as soon as it comes out, first thing symptom will be patient will develop a severe back pain. And when the nucleus or the jelly-like structure, it comes out and presses the nerve root, the back pain will slowly reduce and patient will start experiencing a excruciating pain in the leg, like starting from your buttock, then back of the thigh, back of the leg, into your foot, ankle and foot, along with some paresthesias, that is tingling, numbness, or sometimes they can have a weakness of the ankle and foot. Lifting heavy weight, I will keep it as at the top. Smoking and obesity, I think these are the three major risk factors, and people who lift heavy weights are the ones who come to our OPD with the slip disc with severe pain, who need, I mean, bed rest and analgesics and physiotherapy for a couple of weeks. Most of the times you can diagnose it clinically depending on the patient's symptoms. It's mainly the back pain, the leg pain, which is radiating down the leg into your foot or sole, associated with paresthesia, that is tingling, numbness, or a weakness. And then to confirm that which level the slip disc has occurred, we need a MRI. So MRI will tell you whether it's at the L4-5 level, whether it's a L5-S1 level, which is the more common sites to develop a slip disc. And depending on the MRI, then we have to see, I mean, whether the patient needs a non-operative treatment or a operative treatment. So basically, it's clinically, and to confirm the diagnosis, we need a MRI. What level is the problem? If the patient is able to tolerate the pain well, sometimes there are patients who come to us, I mean, having a huge slip disc, but still they have only mild pain. And there are others who come with severe pain. So it's just a matter of time. If we give them 6 weeks to 3 months time duration and ask them to take precautions and do physiotherapy, definitely they'll recover without, and most of them might not need a surgical intervention. Once the patient develops slip disc, the first thing is, he or she can take bed rest for 1 or 2 days because of the excruciating pain. Beyond 2 days, I don't think they need any bed rest and all. So the pain will be controlled by analgesics. And the only thing I would say, like, again, take precautions while bending forwards. I think that can be postponed for a few days. They should not bend forwards. Lifting heavy weight, they should not lift heavy weights. Then they should avoid sitting on the floor. And I think these are the precautions I would suggest them. and how to get up from the bed. Like most of the patients, what they do is as soon as they are lying down straight in the bed, that is supine position or straight, they'll get up straight from the bed. That shouldn't happen. They should take a side and then get up from the bed. So that also helps in taking care of your back. Good care of your back, I think you can prevent, because see, I am 39. Till now, I mean, this is the peak age where I can develop a slip disc, but I haven't experienced any severe back pain or a slip disc. Maybe a mild back pain here and there. So taking good care, I mean, not lifting heavy weight, not smoking, not being overweight or obese. I think these are the precautions I take, and maybe that's why I think I'm a little fit.